Hello, my name is Florence and I'm a final year nursing student. I've been very lucky to have been placed with the district nursing team during the pandemic as part of my management placement. So when I started my nursing training, I had this belief that to get more exposure to different clinical skills and learn to care for patients with different comorbidities, the acute setting would be more ideal. And boy, was I wrong. My time in the community was, completely opened my eyes to really get to understand what kind of patient group, what kind of conditions, what kind of clinical skills that you get in the community. I've had a chance to have more autonomy, really practice my decision-making skills, critical thinking, and just really caring for your patient and looking at all the holistic needs of your patient. So now with the NHS 5-year forward plan and the integration between the acute and primary setting, that has now meant that there is now an increased acuity of patients within the community. And for me, that meant that I had exposure to a whole lot more clinical skills, a whole lot more comorbidities, and a completely different patient group. So it wasn't just all bandages and leg ulcers and pressure sores like a lot of people would have thought. It was completely different, and I absolutely fell in love with community nursing. So there is a genuine family feel within the community, and that's not just between the team or within the team, but with the patients as well, because you really get to know your patients. And nursing in a different environment, in their home environment, is a completely different science, and a science that I absolutely fell in love with. So if you're someone who is considering community nursing and maybe not too sure, absolutely give it a go. My advice is just go in open-minded and be prepared to be wowed, because that is exactly what happened. And because of that experience that I had, the wonderful team and the supports that I had, I have chosen to be a community nurse, and I was very lucky to have actually been able to get a job with the team. So I'm really excited to be starting my career with them, and hoping all goes well, which I'm sure with their support, everything will be absolutely wonderful. But community nursing is an absolute game changer, and there is more emphasis now for primary care than acute setting. So this really is a good time to be joining the primary care sector. Thank you.